Hi, I'm Dr. Jared Dempsey, Chief Scientist and Executive Director at Trac9.com. At Trac9, we have national data looking at different treatment centers across the country, monitoring things like commitment to sobriety, level of depression, level of stress. Stress and anxiety are highly tied to relapse. We know that the average reduction in anxiety over 4 weeks of treatment is 29%. Now, if we look at Terra Treatment Center, the average reduction over 1 month of treatment is 38%. They're particularly skilled at reducing anxiety, far beyond the national average. The key to Terra Treatment Center's success in reducing anxiety has to do with the hard work and commitment from the therapists located there. For example, Ariel Underwood does particularly well at reducing anxiety. Ariel's now going to walk us through some of the skills and techniques that she uses with her particular patients.
In the field of psychology, we know a lot about top-down approaches to treating depression and anxiety, so things like psychodynamic therapy, cognitive behavioral therapy. Here at Terra, we're working with guys for 30 days. We're learning to use a lot more of what we call bottom-up approaches, which are things that we can do kind of more in the moment, using the body to make a change in the brain. A big thing that we talk about, and we touch on a lot in group, is knowing your anger triggers, knowing your relapse triggers, your anxiety triggers. So just what are those little things that are happening in your body that you can start to tune into? I know I'm getting anxious. For me, my face starts to get red. My hands start to shake a little bit. For a lot of people, it's that feeling in the chest, that like tightness. And so if we can start to recognize those, then we know, okay, I need to do something. Whether that be just take a walk. We talk a lot about breathing techniques that we can use, diaphragmatic breathing in particular. And so it's really just about learning the difference between like taking shallow breath into the chest and taking big, deeper breaths into the belly. So in group, a lot of times I'll have the guys practice, put one hand on your chest, put one on the belly, and we'll play around a little bit with the difference. I'll have them breathe into the chest a few times and just see kind of what that feels like. And then breathing into the belly, taking those deeper breaths and just noticing the difference. When we're using the diaphragm to breathe, we are triggering a relaxation response in the brain. So what we know about both trauma and anxiety is they both involve dysregulation in the amygdala. That's your fight or flight center. So in both of those cases, your amygdala is kind of taking over, goes into hyperdrive. We get disconnected from the prefrontal cortex. So it affects our ability to be able to think rationally, to reason. When we're working with addiction, when we're working with anxiety, there's a lot of impulse. A lot of those big decisions like leaving treatment, leaving ASA, that's an impulsive decision. So if we can just kind of get through that moment, let's take a walk, let's just kind of breathe, get to where we're a little bit more relaxed, then again, we can generally have a little bit more of a conversation where we're able to think about it rationally and play out the consequences of what that might look like. We use a lot of modeling here. A lot of times I'll just come into the room and I'll sit down and I just take a nice deep breath. The most recent example I can think of is I had a guy on the phone and I could hear it was getting escalated. So I just walked in there and I put one hand on my chest and one on my belly. And at this point he knows what that means. And so I just started taking nice deep breaths and he was able to reflect that. And from there, the conversation started to de-escalate. It's very helpful having the Trac9 results. For a lot of us, we get really good at hiding anxiety, depression. So a lot of times, someone who is just incredibly anxious, that might come off as, like I'm in group making jokes, I'm super social. So it definitely helps us to identify when someone's struggling with that. I think it's really nice for the client to be able to have something tangible where he can see his progress in treatment. It also is really helpful because sometimes right around the end of treatment, those scores will go way up again. So we can see if someone is getting anxious close to their discharge. It also helps to explain behavior sometimes. We get close to discharge and sometimes we'll see a guy who's been doing really well start to self-sabotage, start to act out. And so we can show him now the score and help him make sense of that.